Assalamualaikum and good morning everyone. My name is Nur Farahin Gapa and I am a PhD student from the Center for Nursing Studies, Faculty of Health Sciences, University Technology Mara UiTM. So today I am pleased to present a module entitled Reflective Practice for Intensive Care Unit Nurses. This module is developed to support ICU nurses in strengthening reflective practice as part of their professional development and lifelong learning. It is developed under the supervision of my supervisor, Associate Professor Dr. Siti Khuzaimah Ahmad Sharoni, a senior lecturer from Center for Nursing Studies, Faculty of Health Sciences, UiTM. Without further ado, let's begin with the overview of the module. So this module is organized into 6 chapters, Chapter 1 to Chapter 6. Chapter 1 introduces the fundamental concept of reflection and reflective practice, as well as an overview for the care framework, which forms the foundation of this module. Chapter 2 focuses on cultivating reflective practice, helping nurses develop reflective thinking and self-awareness. Chapter 3 discusses strategies for alleviating and managing stress, enabling the nurses to cope more effectively with the emotional demands of a critical care. Chapter 4 emphasizes reinforcing professional fulfillment by promoting professional growth, job satisfaction, and resilience. Chapter 5 explores ways to enhance quality of life, supporting the overall well-being of the ICU nurses. Finally, Chapter 6 integrates all 4 components of the care framework into clinical practice, enabling nurses to apply reflective practice systematically in their daily work. In today's presentation, I will focus on Chapter 1, which introduces the concept of reflective practice and the care framework. So this is the learning outcomes. At the end of this chapter, participant will be able to define reflection and reflective practice, differentiate the 3 types of reflection, explain the importance of reflective practice in the ICU, identify common challenges to reflective practice, and describe the care framework and its application in ICU nursing. So for the introduction, before we discuss on reflective practice, it is very important to understand the working environment of intensive care unit nurses. So ICU nurses work in one of the most demanding areas of the healthcare, and they are responsible for providing safe, high-quality care to critically ill patients while facing continuous psychological, emotional, and ethical challenges. On a daily basis, they must make rapid clinical decisions, collaborate with multidisciplinary teams, communicate effectively with patients' families, and manage emotionally demanding situations. Because of these challenges, reflective practice has become an essential component of a professional nursing practice. It enables nurses to critically examine their clinical experiences, learn from both successful and challenging situations, enhance self-awareness, manage more effectively, and continuously improve their knowledge, skills, and clinical competence. To facilitate the process, the care framework was developed as a structured, theory-based approach to reflective practice. The framework consists of 4 key components: cultivating reflective practice, alleviating and managing stress, reinforcing professional fulfillment, and enhancing quality of life. Together, these 4 components provide ICU nurses with practical strategies to strengthen resilience, promote professional growth, improve well-being, and ultimately enhance the quality and safety of a patient care. So next, this module is developed based on established reflective practice theories to ensure that learning is both evidence-based and applicable to clinical practice. So the CARE framework incorporates Gibbs reflective cycle and Schott reflective theory. These theories provide a systematic approach for nurses to reflect on their clinical experiences, strengthen critical thinking, enhance resilience, and promote continuous professional development. Each chapter includes interactive learning activities, real-life ICU scenarios, case discussion, and reflective exercises. And these learning strategies are designed to encourage active participation and help nurses apply reflective practice in their daily clinical work. Finally, the overall aim of this module is to empower ICU nurses by strengthening their reflective skill while improving professional fulfillment, well-being, and overall quality of life. And ultimately, these improvements are expected to contribute to a safer, higher patient care and support the long-term sustainability of the nursing workforce. So this is the chapter 1. It is entitled Overview of Reflective Practice and the CARE Framework. So this chapter serves as the foundation of the module by introducing the key concept of reflection and reflective practice. It is also provide an overview of the CARE framework, which form the basis of this reflective practice module for ICU nurses. The concept presented in this chapter will establish the theoretical foundation for the remaining chapters. So let's start. So what is a reflection? Reflection is a structured process of critical thinking that enables individuals to examine their experiences in order to learn, improve, and achieve personal and professional growth. And rather than simply recalling an event, reflection involves analyzing experiences to gain meaningful insight and identity, practical meaningful insights, and identify practical action that can improve future practice. And reflection also promotes self-awareness by encouraging individuals to evaluate their thoughts, decision, and action. And through this continuous process of evaluation, learning becomes an ongoing cycle of improvement rather than one-time event. So therefore, reflection serves as an essential foundation for lifelong learning, continuous professional development, and evidence-based nursing practice. According to Schott reflective theory, reflection can occur at 3 different stages of practice. These are reflection on action, reflection in action, and reflection for action. Reflection on action takes place after an event. It involves looking back on past experiences, evaluating what happened, and identifying lessons that can improve future practice. Reflection in action occurs during an event. It allows nurses to think critically while providing care, adapt to changing situations, and make appropriate clinical decisions in real time. Finally, reflection for action occurs before future events. It focuses on planning, anticipating potential challenges, and preparing strategies to improve future performances. In a professional context, these three types of reflection help nurses to understand their own practice, learn from colleague perspective, and continuously refine their clinical knowledge, decision making, and patient care. This makes reflection an essential component of professional nursing practice. So what is reflective practice? Reflective practice refers to a systematic application of a reflection in a real-world clinical situation. Unlike reflection, which is focused on thinking about experiences, reflective practice involves applying those insights to solve a problem, improve performance, and promote both personal and professional growth. Reflective practice is commonly guided by structured models that help healthcare professionals break down complex experiences into smaller components for deeper analysis and understanding. One of the most influential theorists is Stern reflective theory, which encourages professionals to reflect on what they do, how they do it, and how future practice can be improved. And therefore, reflective practice transforms reflection into meaningful action, enabling continuous learning, better clinical decision making, and ongoing professional development. So what is the significance of reflective practice in ICU setting? The ICU itself is one of the most complex and emotionally demanding areas in the healthcare. ICU nurses are responsible for caring for critically ill patients while making rapid clinical decisions, manage ethical dilemmas, collaborating with multidisciplinary teams, and frequently providing end-of-life care. Those high-pressure situations require nurses to respond quickly while maintaining safe and high-quality patient care. Without opportunities to reflect, continuous exposure to these challenges may affect clinical performances, emotional well-being, and professional confidence. Therefore, reflective practice is not simply beneficial, it is essential. It enables ICU nurses to learn from their experiences, improve future clinical decisions, strengthen resilience, and continue providing compassionate, patient-centered care in this demanding environment. So why reflection matters in ICU? Reflection is particularly important in ICU for various reasons. For example, ICU nurses frequently encounter moral and ethical dilemmas while caring for critically ill patients. So this situation may include difficult decisions such as continuing or withdrawing life support, communicating with patient families, or balancing complex treatment options. In these circumstances, reflection provides an opportunity for the nurses to critically examine their decision, values, and action. Rather than reacting emotionally, reflective practice encourages thoughtful evaluation of what happened, why certain decisions were made, and how similar situation can be managed more effectively in the future. As highlighted by Brookfield 2022, reflective practice support ethical decision-making, strengthen critical thinking, and promote continuous professional growth, enabling ICU nurses to provide compassionate and patient-centered care even in the most challenging situations. Besides supporting ethical decision-making, reflective practice also strengthens clinical decision-making in the ICU. ICU nurses often need to make rapid decisions in high-risk and unpredictable situations. By reflecting on previous clinical experiences and intervention, nurses can identify what worked well, recognize area for improvement, and apply this lesson to future patient care. This process helps build clinical confidence and enhance clinical reasoning skills. Reflective practice also contributes to nurses' psychological well-being. It provides an opportunity to process stressful experiences, reducing the risk of burnout and fatigue. Furthermore, discussing reflection with trusted colleagues create emotional support and strengthen resilience. According to Brookfield 2022, reflective practice promotes continuous learning while reducing psychological burden, enabling the ICU nurses to maintain both professional competence and emotional well-being in demanding clinical environment. So this figure illustrates ICU nurses demonstrating professional commitment and solidarity while providing care during a public health crisis. So these real-life experiences reinforce the importance of reflective practice. Reflecting on such experiences help the nurses to recognize their strength, learn from challenges, strengthen professional values, and continue providing high-quality patient care, even in the most demanding circumstances. Although reflective practice offers many benefits, it is often difficult to implement in daily clinical practice. One of the major challenges is time constraint, as ICU nurses work in a fast-paced environment where patient care is always the priority. Another challenge is the demand of 1-to-1 or 1-to-2 patient care, where the nurses must provide continuous monitoring and immediate intervention for critically ill patients. These responsibilities leave very limited time for the structured reflection during working hours. In addition, some nurses may hesitate to share their experiences because of the fear of judgment from the colleague or supervisors. As a result, opportunities for open discussion and reflective learning may be reduced. Addressing these barriers is essential to create an environment where reflective practice can become a routine part of a professional nursing practice. So moving on to the importance of supportive environment in promoting reflective practice among ICU nurses. Reflective practice is most effective when nurses feel psychologically safe to share their experiences without fear of criticism or judgment. A supportive environment encourages peer reflection, open communication, and honest self-appraisal, allowing the nurses to learn from both their own experiences and those of their colleagues. Regular reflection discussion also provide emotional support, helping the nurses cope with the challenges of caring for critically ill patients while reducing feeling of stress and isolation. Ultimately, creating a supportive and learning-oriented culture, strengthen teamwork, promote continuous professional development, and contributes to higher quality patient care in the ICU, as highlighted by Brookfield 2022. So this is the references. Thank you.